That's a lie. It's an outright lie. And they continue to lie. I mean, what a surprise.
Last winter, we had 500 avoidable deaths a week. That's a Boeing jet of patients going down, and that's completely unacceptable.
If you train for 7 years, you expect to be able to live.
They've broken the system, they've tried to break doctors, but we have no option to fight back.
Overworked!
Underpaid!
Overworked!
Underpaid!
Overworked!
Underpaid!
Today we're out on strike for the 11th time. Doctors have been in dispute with the government for the past 20 months because our pay has been cut by 26% over the last 15 years.
And what that would look like is a doctor who starts on £15 an hour, getting paid about £21 an hour. Back in December, we had Victoria Atkins, the Secretary of State, say that she'd be back round the table and she had another offer to make within 20 minutes. That was 6 months ago, and we've had no further offer.
And we're yet to hear any offer from the Health Secretary. Last month, the government walked away from negotiations, abdicated their responsibility to resolve this dispute, and gave doctors no option but to call for strikes. And even now, even at this late stage, the government can repair the trust that they've broken with doctors by walking out of negotiations. And they can do this by making a firm and public commitment to pay restoration, and that would be enough to call off the strikes.
Their living standards have fallen consistently. There is a massive backlog of patients waiting to get into this hospital and every other hospital to get things done, and many of them are actively considering leaving the NHS altogether and going abroad where they will get better pay and conditions. We have a crisis in the NHS, and it cannot be resolved by warm words. It can only be resolved by putting hard money into the NHS to pay for increased salaries for all staff in the NHS, in this case today particularly the doctors, but also to deal with the patient backlog.
We've had a real terms pay cut in total of 26%. We don't see 26% less patients. We don't do 26% less work.
What happened to the 8.8% offer? Was that non-negotiable for you?
So that wasn't an offer, that was something that the alleged independent pay review body made a recommendation on, and that was implemented without our consent. We want to be able to have a proper discussion about how we're going to be able to get to pay restoration, because no doctor is worth less than they were in 2008, and the fact is that pay erosion, which has undervalued us, has pushed doctors away. We lose about 15 to 20,000 doctors a year through multiple different reasons. A large part of it is pay. We see so many people going to Australia, New Zealand, Canada, and then when you look at the workforce crisis that generates, it's easy to conclude with all of the outcomes of things like the waiting lists going up, the time it takes to see people in A&E being exorbitant. We're seeing the winter crisis bleed into summer. Just yesterday, a patient was telling me that they waited 10 hours in A&E.
Just to be really clear, Kevin Hollinrake, the small business minister, has been out on the broadcast round this morning, and he said that you've had an 8.8% offer. So that's not true.
That's a lie. It's an outright lie. And they continue to lie. I mean, what a surprise. Victoria Atkins said that she had another offer to make. She'd be back round the table within 20 minutes in December. That didn't happen. We've had no further offer. So I'm very happy to say that is a lie. We have not been given an 8.8% offer.
Pay restoration, it's fair, it's reasonable, and it's affordable to the taxpayer. It's fair because we're asking to be paid exactly the same amount. We're not asking for any more money. It's reasonable because we're asking for a doctor that's paid £15 an hour. That's with £100,000 worth of student debt, going through medical school, which is 5 to 6 years. We're asking a doctor to be paid £15 an hour to be paid £20 an hour. And it's affordable to the taxpayer because pay restoration in total would cost around $1 billion, and the government's already spent $3 billion covering for the strikes. That's 3 times the cost of pay restoration. So it's fair, it's reasonable, affordable to the taxpayer, and it's a no-brainer at this point to pay doctors because it's almost unaffordable now not to.
A lot of Conservative ministers have described this dispute as political. They said that they've put the strike during an election deliberately to upset the Conservatives. Would you agree with that?
No, I think what it is an absolutely correct time to call a strike, to say to all parties in the election, listen, you're all going and giving it large all over the country saying we're going to fix this, this and this. We're here, We demand decent pay, we demand investment in our NHS, tell us you're going to do it or not.
So we were in dispute with the government for 20 months. That was 20 months they had to come forward with a credible offer. The government failed to do so. They promised us that we'll be going into mediation, which both sides mutually agreed on, and then pulled the rug from under us and said there's going to be a general election. It's their choice to go into a general election with an open dispute.
I mean, we've been trying to have good faith negotiations for a very long period of time. And the government, what they did was they threw up their hands, abdicated their responsibility of negotiating, and they had no plan to negotiate. They've called an election and they've walked away from the table. And what we're asking for is for a commitment from Rishi Sunak for his alleged clear plan and bold action on how he's going to be able to resolve this dispute should he form the next government. And he's made multiple commitments to multiple other things recently in his manifesto. Why can't he make one to fixing the issues in the NHS and the workforce crisis that we face, which is primarily due to the massive 26% pay erosion we've had over the last 15 years?
So sometimes on a shift, what we're doing is running from patient to patient, trying to stabilise them because we don't have enough time to treat them properly, treat them to the end, which is what we want to do. We get trained at medical school on how to give gold standard care, which is the best care for a patient to make sure they get the best outcomes. We're unable to do that at the moment, and we're just trying to keep them alive until the morning where the main team comes in. So we're under a huge amount of stress and pressure because patients are coming in again and again with the same problems, and they're not able to have the definitive management, which might be surgery, because the waiting lists are so long.
Well, I meet many constituents who have been waiting for a long time for not just elective surgery operations, sometimes actually quite serious conditions where they're in significant pain. I was talking to somebody last week and said, well, I've only got another 6 months of pain. And then the person said to me, I wish I could afford to go private. Not because they want to go private, they don't. I said, you shouldn't have to have that, even have that thought in your head. You should be able to get proper treatment. So it is an issue that comes up all the time. I also meet a lot of medical professionals. We have a local hospital, and I've been outside the train station just next to the hospital. And they all come and tell me how much they love the NHS, they love their jobs, that they're passionate about being doctors, nurses, oncologists, whatever, and they can't afford to stay doing it. They said they would earn more money as a barista. Now, baristas should be properly paid, don't get me wrong, but if you train for 7 years, you expect to be able to live.
It's dreadful, okay? We don't even have chairs. We sit on bins. The computers don't load up. The software doesn't work. You have 5 or 6 different things you need to log into. The printers break down. No one can fix any of these things because there is no one to fix them. And all of that administrative burden falls on the doctor so that we can actually do our proper job, which is seeing patients and treating patients. People are operating and working on empty stomachs, feeling faint. What we need is proper infrastructure, proper buildings, proper ventilation, proper computer systems, proper rest facilities, proper catering. We need a proper contract, and we need our pay restored.
Wards remain understaffed, and we have a real workforce crisis. So now, we used to have real standards in this country before, but now, where are they? Patients used to be seen within 4 hours in A&E, and now you're lucky to be seen within 12. Doctors, we're patients, our families are patients, and we've seen the quality of care in this country decline. And it's very scary what the future holds if we don't invest in our workforce. The government needs to understand, if they don't invest in their workforce, then they're never going to have a functioning healthcare service.
Do you think that potentially the Conservative government are not agreeing to the 35% because then they might have to agree to other members of the public who are on strike?
Quite probably they see the NHS pay as something that would be then replicated elsewhere. Well, yes, it would be, and that's because from 2010 onwards we've had austerity budget after austerity budget. The living standards of most people in working has fallen by 20% in the past decade. So we're a country of declining living standards, increasing poverty, increasing food banks, and increasing levels of insecurity amongst professions. I mean, if somebody had said to me, as a young person, the doctors are going to go on strike. I said, what? It was sort of, doctors were a well-paid, secure profession. You would never believe that. And now, here they are, quite rightly on strike and supported by manual workers within the hospital.